I want people to see. Guys, I know I'm supposed to be filming right now, but I'm on this website just finishing up what I'm doing. Before I get started, you should probably take notice of what my neck looks like when I'm on my phone. I actually don't live on my phone. I don't spend a ton of time on my phone. I prefer not to. I prefer to look right at people and have discussions with them like this, which is actually pretty rare these days. If you've ever noticed, if you go to a restaurant when they used to be open and you see 4 teenage girls sitting at like a Chick-fil-A, for example, down the street, they're not actually talking to each other like this or laughing or giggling or even throwing things at each other or whatever products and stuff that they are using. They actually are all sitting there like this and they're not talking. Maybe they're talking on their phones through the phones to each other. I actually wouldn't know. But this video is dedicated to young people and why your neck hurts all the time. So I know that that's probably kind of confrontational to look into, but the reality of the situation is if you stop and remember what my neck looked like just now, we're going to talk about what that does to a neck over time. So when you're a teenager, your body is very, very forgiving. You may have bad posture, but it really doesn't bother you because you don't know you have bad posture, or maybe it doesn't hurt yet. Okay, but as time goes on and those postural imbalances get more severe and they start to stick as your body and your nervous system start to recognize them as normal, they will no longer be serving you. So young people actually have neck pain and headaches all the time. Most of them will attribute this to poor posture from sleeping. Oh, I slept on it wrong, or I was stressed out, or I was really tired and didn't appropriately get ready for bed and I just crashed in the bed and my shoulder was jacked up here. Okay, so our spine right now actually already is a little bit twisted and a little bit turned, and I haven't put him back yet because it's very indicative of what our young people's spines here. Look, we've had about 12 or 14 new people come in the last 2 weeks, all very young, and they all seem to have the same thing. So we're going to talk about that their symptoms were down here in the low back, but their cervical spine posture was utterly destroyed. It was completely gone. So a normal posture looks straight up and down. So there's no curvature from the front, and there is a 45 angle right here in the middle of the cervical spine. And there's this curvature called the lordosis. And all of the facets in the back of your spine, all 7 of those bones, align very nicely, very appropriately. The stress is evened out over this arc of life like we've talked about before. And when you turn your neck, you don't hear clicking or popping or sounds, and you don't have any pain because the facets glide very, very conveniently. When you look down at your phone all the time and your chin is tucked, your spine starts to look like this. We have chronic forward head posture and military cervical spine. So what ends up happening is you start to grind and click when you turn your head, and it causes early decay, early arthritic decay, and not only that, but it puts a lot of pressure on these nerves, putting you at future risk of arthritic decay and nerve damage that goes along with that. People in their teens and 20s are not old enough to have spinal decay, degenerative joint disease, and nerve damage. They're just too young for that. But some of them actually have had this problem going on since they were probably 12 or 13, using cell phones and online textbooks or what have you. And their head is so far forward that they've put a ton of pressure at the CT junction right here at the base. And it's put so much pressure on these nerves here at the side that when they come down into the arm and the brachial plexus, it makes their arm fall asleep all the time. And I think there's something wrong with their arm. There's nothing wrong with their arm. It's actually coming from their neck, but you wouldn't know that until you look at their posture, and their shoulders are so far rounded, it's like they're losing 1.5 inches of height. So the goal is to have a very, very appropriate postural check and start to repair the posture, not just with chiropractic adjustments, but with a change of habit. Okay, the changes in your habits every day will help you repair. And one of the main things I like to teach here with chiropractic care is that chiropractic care is not going to cure everything. I can't do all of the work for you. I'm going to assist you in getting your health back. I'm going to assist you in telling you what the problem is. But you know more about what actually the identifiers are than I ever will. Once people start to get adjusted and they feel better, their head comes back over their shoulders, the postural curvature starts to repair, and their cervical muscles get stronger, they start to feel better. When they return back to those bad habits of being on cell phones constantly and not having their head up looking straight out to the world or looking, thank you, Jerry, straighten right up as I'm talking. Everybody gets straightened up. It's like I'm the general or something, but not really. The cervical support muscles in the back of the spine that attach from the front of the neck to the back of the spine is processed here, and some of them are vertical and some of them cross. Okay, those muscles get exhausted because when your head gets forward and your shoulders go down, these muscles have to pick up the slack. Your body has innate intelligence. It knows that there's something wrong with this and it doesn't like it. So when your posture is sustainably abnormal, it becomes very, very difficult for your body to cope with. As I mentioned in the beginning of the video, teens and 20-somethings, they get forgiveness. By the time you're in your mid to late 20s, your body is done forgiving you. It's tired and it starts to tell you that there's something wrong. So the majority of our new patients are actually, I think the oldest one was 31 in last week. So that really does say a lot to young people taking care of their health. So thank you for that. That's a huge trend and a huge change in our trend, which we definitely want to see happen more. And also taking responsibility and making sure that we change those postural bad habits. So make sure every once in a while, put your phone down, get your head back up, get the shoulders back, round everything. Okay, thank you. Everything's looking good over there. We're going to film again here in the next couple days in the near future, and I'm going to show you guys and demonstrate what abnormal posture looks like from a standing position, and then we're going to exemplify what the wall posture looks like. It's a cheap, very deceptively easy exercise that you can do at home. It's not cheap, it's free, right? The free stuff you do at home that I teach my patients how to do is actually the best. It's the stuff I did for myself when I wanted to go through postural correction. But it is your daily habits over and over and over again that lead you to where you are when you start to develop health and wellness concerns. So remember, the chiropractic care is a big portion of making the change, but the majority of the change that will seal the deal is within you and being committed to making sure that your habits change a little bit, and hopefully we can be a little less addicted to our phones. Once our neck changes back to normal, we'll start to value what our body wants us to do, and we'll look right at the camera or right at each other. It's been great chatting today. I hope you guys learned something fantastic about postural repair and chiropractic care. And remember, put the phone down, look straight out at the world, smile, wave every once in a while. Maybe bring a smile to a stranger's face. And we will see you guys the next couple days, if not next week, talking about some exercises you can do at home to help your neck. Thank you.